Thing I want to say before we start commentating this is, Rollie, kudos to you. It's very important that you are showing this because, number one, when these people advertise for cosmetic surgery, it's always the voluptuous, gorgeous, skinny woman that has no curves. But they don't really show what average women look like. They don't really show the big girls that come on there because it's not marketable. Everybody wants to see the skinny girl, but that is not always true. You're going to have some healthy women get on there and you're on the table, and then you're going to have some women that just have a couple extra pounds, and it's all natural, it's all normal. And I just want to say thank you for doing this.
The ideal bodies that I want. So curvy Christy, but she's more taller, so of course she'd have more weight.
The infamous wish pick. Ladies, sometimes people's wish picks are just wishing. Okay? So, I don't mean that as no disrespect, but make sure that you pick a wish pick that is reasonable for your body type and body size, okay? Because you don't want to go into having a certain expectation or a certain look during the surgery that is unreachable. You want to find something that is going to be beneficial to your body type and body size.
Hi, how you doing?
Good, how are you?
Nice to meet you.
The office, or AKA the coordinator. Now, this is going to be the person that you talk to on the phone the most. Now, when it comes to these surgical centers, either it's going to be a office assistant or an NRCMA, which is somebody in the medical field that is going to be answering these questions. Depending on the surgical office that you go to, you don't necessarily have to be certified in nursing to work the front desk office. So when it comes to you guys asking questions and needing to know certain things, and there's miscommunication, or you have one person saying one thing, sometimes in situations that's where that lies, because sometimes the person that is in the office is not necessarily the nurse practitioner, and sometimes the surgeons actually train their front office desk to make it able to answer these questions that you guys need. So that is where the confusion comes with that. These are the people doing the scheduling, collecting payments, booking you, answering the phone, etc. All the things. They're going to be the first person that you reach when you reach these offices, so they may or may not know the answers to give you. So sometimes it does take a while to get to the surgeon or the nurse practitioner because of these issues, and sometimes they may or may not answer the questions correct.
Dr. V,
Hi.
I'm bringing in your lovely patient.
Hello, ma'am. How are you?
Nice to meet you, Dr. V.
How are you? Have a seat. So, how are you doing?
I'm good.
Excited? Nervous? Which one?
Both.
Great. I like when the people nervous, actually, because now you kind of understand you're coming for a procedure and with the procedure. Any questions?
I understand I am doing it in sections.
Mm-hmm.
So when will I be able to come back for like my back?
You have to understand, we have to be realistic.
Yeah.
Meaning, we're going to take a lot of bulk right now here. Since we're doing the BBL, it's probably about 2-3 months.
Let's talk about what she just said. She's receiving multiple sessions and sections with lipo. And then her first is lipo 360 BBL. You guys already know what that is. If you don't, it's where they suck out the fat. 360, front, back, sides, and they take the fat and transfer it to the butt. Now, am I a fan, and this is my personal opinion, am I a fan of doing a BBL on a bigger woman prior to them losing weight? No, but we're going to continue to watch this and see how her procedure goes. And the reason why I feel that way is because of the shape of the butt. But this is episode 1, so we're going to see how everything turns out.
Okay.
Yeah, we just don't want the body to go through this extra stress. Not
Yes.
heal personally in the body. The body have to heal. It takes a little bit of time.
And that's what I want to definitely do too. I want to make sure my health is good because I want to be here for the long run. And I know the older I get, it's going to be harder for me to lose the weight.
And as you can see, she's talking about this because she's doing this. She's doing this for her health and to help start her weight loss journey to losing weight. It is very common for ladies to get this, so don't be intimidated by getting these surgeries when you just see women that look like video vixens receiving these surgeries. There's different people, and I'm so happy that she's doing this. Now, when she talks about her health, don't lie. If you have sickle cell anemia, if you have any kind of illness in your family or with yourself, regardless of whether you go out the country or not, tell the truth. Tell the truth, because you have anesthesiologists that have to measure and watch you during these procedures. And that's where a lot of the deaths come from. It doesn't come from the doctors or surgeons. In my personal opinion, it comes from the lying about health issues. Now, I'm going to leave the actual surgical procedure alone so you can go to Zues and watch it. But if it's something that you've never seen before, take a look. It's one of the most fascinating things ever.
Across this, I ain't fucking like this is a bed, so those got to go down.
Oh, Jesus.
Y'all, I got ass hips and everything. We gonna have to get some steps or something. How the fuck am I supposed to get up here?
Your phone in your hand, Rollie?
Girl, I'm on live. Y'all, okay. I'm trying to get in the car. Is there some little steps I can use? Oh, I know she got some steps.
Let me go get that black thing.
Yeah, the black thing. I can get up in there with that. Y'all, let me just bend over a little bit, okay? She said, what are you doing? Miriam, help me in the trunk.
Oh, Jesus. Okay.
You holding my booty?
Now, this was very disheartening to watch because I believe that Rollie should have been taken care of properly, better than this. Now, the supply kit list that you get in the beginning that tells you everything that you're going to need prior to receiving this surgery, I have no knowledge of whether she received that information or not, but you're supposed to make sure that you have bedding and plastic covering for your car before you get in there, and you're supposed to be properly dressed. I don't like the way her wounds were kind of exposed. She really wasn't really protected after surgery, and to me, I seen her step back a couple times. She was faint and she was tired. Now, due to the anesthesia and the lidocaine, you guys think that you're superwoman at that time, but it's okay to calm down, relax, and chill, because we don't want you to hurt yourself as soon as you leave the surgery facility. And from what I seen from that, I just think it was improperly prepared for her post-op. I wish they would have done a better job on that.
But you know, I guess people just gonna fucking talk. All I'm tripping about is whose man's I'm gonna be taking my man. Y'all stay worried about me. A special moment for everybody. Y'all bash me for being a big girl. I feel like I'm tired of explaining myself to people. My heart is healthy, my blood is healthy, everything is healthy. Don't stress, Goldie.
And I just chopped that video up into pieces to show you guys something that after the surgery, there is a lot of emotional issues that you guys will go through due to the anesthesia, lidocaine, and the painkillers. It's completely normal. You guys are going to be mean. You're going to be crying. You're going to be laughing. You're going to talk nonstop. It is completely normal. Please be mindful of that, and also your support system needs to be mindful of that as well, because it could be irritating at times, and we don't want people to leave you due to the fact because you're going through all this after surgery. And don't get down if you are in this state of mind. And try not to be too depressed and sad during this time, especially if your results didn't come out the way that you wanted to when you look at it, okay? So try to stay positive. Try to surround yourself with positivity. Try to stay positive and surround yourself with positive people. And we'll catch episode 2 together.